The countdown is on when it comes to mandatory health insurance, and today state officials work to help those in the area understand what the nation's health care law means for them. Good evening and thanks for joining us tonight. There's less than a month before the uninsured are required to start looking for a plan.
And if you're uninsured and don't have coverage, starting next year you could face a fine. According to state estimates, about 500,000 Wisconsinites will need to use the health insurance exchanges. And as we've reported, we're getting a bit of a better idea about what those plans will cost. Fox 11's Alex Rinaldo tonight with multiple views about what the currently uninsured can expect.
As an independent insurance broker, Chris Hansen is trying to learn all she can about the Affordable Care Act.
To anticipate what some of those questions are going to be to us as the exchange opens in less than 30 days.
Hansen joined about 100 others at a meeting in Appleton held by the state's Office of the Commissioner of Insurance. Spokesperson J.P. Weisky says he gets a lot of questions about the timeline.
I think it's important for them to know that they've got to buy policies by December 15th in order to have that January 1st effective date.
But the meeting was not without controversy. Earlier this week, the office released a report which suggested insurance premiums will rise between 9 and 125%. Weisky told the audience the office's methodology was accurate, but some at the meeting questioned those numbers.
It indicates to me that there may have been other methodology used as well in order to come up with rates that may have been preferred by the current administration.
We didn't want to scare people, but by the same token, we didn't want to have people have unrealistic expectations. It's going to depend on the individual situation. So they need to look, they need to shop, and they need to be aware of what's coming.
A study by private data analysis firm Avalar Health shows under the new exchange, a 21-year-old would pay about $270 a month for a mid-range policy, which would cover about 70% of medical costs. The study suggests a 40-year-old would pay $330 a month for the same coverage, and a 60-year-old would pay $615 a month. But those numbers do not take into account possible tax credits and government subsidies, which are expected to cover a lot of costs. Weisky would not discuss exact numbers, saying it's impossible to know what they will be until the exchange opens.
They just need to be talking to their agent, looking at who's available from a certified application counselor, navigator down the road, or somebody they trust to understand what's coming.
In Appleton, Alex Rinaldo, Fox 11 News.
The insurance exchanges will open October 31st. The open enrollment period for those without insurance ends March 31st.